Hi, good morning.
Hi. Good morning.
My name is Stephen Donson. I am the invigilator, here for the OET speaking test conducting on January 18th, 2020. What is your full name?
My full name is Charlotte James.
Can I have your passport, please?
Yes, sure.
Can I have your candidate number, please?
My candidate number is 473926.
All right, great. Now, we shall start the warm-up session. What are you basically?
I am a registered nurse, and I am working as nursing supervisor in Mihiraa Hospital, Pala, Kottayam.
Do you think nurse should attend continuous nursing education?
Yes, I do think so because continuous nursing education enables the nurse to work according to the current trends in the nursing profession. Moreover, they can update their professional skills too. Nowadays, in many hospitals, it is mandatory to attend specific hours of continuing nursing education in order to renew the nursing registration. I believe it will strengthen their knowledge to meet the current standard of nursing. So I believe that it is very important for a nurse to attend it and keep updated.
Describe your typical working day.
In my hospital, we start the day with prayer. All the duty nurses who are just in for duty will gather for the prayer. We start our duty at 8 o'clock in the morning. I start my duty with inventory checking and updating the crash cart in my ward. After that, I'll find which patients are allocated for me by the ward in charge. After finding the patients, I'll take handover from the nurse who was on duty. Once after getting the complete handover, I prefer to have an interaction with my patients in order to identify their health needs and to maintain a good interpersonal relationship. As per the assessment, I prepare a nursing care plan and ensure quality care for my patients. Then I assist the physician in doing work and carry out necessary orders. Even though, in busy schedules, I will try to maintain good interaction with my colleagues to have a successful team. We have a 6-hour duty roster. Once my duty is completed, I'll give a detailed handover to the next schedule staff nurse. And I will leave the hospital only after informing the patients as well as the ward in charge.
What are the major responsibilities of a nurse?
Registered nurses have a number of responsibilities such as dispensing medicine following doctor's order, providing high-quality care to the patient, recording and reporting all the incidents, and also should be professional.
Do you believe there's gender disparity in your profession?
No, I really don't believe so because nowadays we can find many nurses from both genders. However, in the olden days nursing was a profession that was dominated by female staff. But now the scenario has changed a lot and we can find an increasing number of male staff in the nursing profession. And I can proudly say that every staff nurse is truly passionate about their profession despite of gender.
Are you comfortable working with other doctors and nurses?
I find I work well under a variety of conditions and circumstances, and I take pride in my flexibility. I really enjoy working in a big team because I often find different viewpoints can help me find solutions to a problem that I might not think of on my own. I also enjoy self-motivating, and I am equally comfortable working alone.
So, that's the end of the warm-up session. We shall move on to the task question. I can help you out with the task card. You have 3 minutes to prepare, and further you can start on. So, the preparation time is up now. You can start role play.
Okay. Hello Stephen, my name is Jessica, and I will be your attending nurse today. As I understand from your case notes, you are scheduled to undergo a colostomy day after tomorrow. Is that correct?
Yes, I've been scheduled for colostomy day after tomorrow.
Thank you for the confirmation. You seem quite anxious. May I ask what's been bothering you?
Yes, I'm a bit nervous. I have a few concerns. Is this colostomy a long procedure? whether it's too painful. I spoke with many patients who undergone colostomy, and they let me know that it is really painful, and now I'm a bit worried about it.
I do understand your anxiety. It's a daunting prospect, especially because it's your first surgery. That being said, let me assure you that we will care for you at every step, before, during and after the surgery. Could you tell me a bit more about your fears or worries in regards to the surgery?
I'm really afraid about the pain during and after the surgery.
Yes, that's a reasonable fear. However, there is nothing to be alarmed about because your surgery will be performed under general anesthesia, and you will not experience any pain during the procedure. Even after the surgery will be done, any post-operative pain will be managed effectively with medication. Does that make you feel a bit better?
Yeah, really. But still, few things disturb my mind. I am worried about my life after the surgery. Anyways, I know that my life is not going to be the same as now. I wonder whether I would be able to travel or to participate in social activities as before?
I can sense your anxiety about coping at home after the surgery. If I were you, I would be worried about my transition to routine life too. Let me assure you that you will be provided comprehensive support to adjust physically and psychologically after the surgery to ensure that it does not adversely impact your life in any way.
All right, now I would like to know about the care of the wound after surgery.
Oh. Okay, the stomach care nurse is the best person to explain that to you. She will meet you and give instructions on colostomy care and equipment required so that you don't feel completely dependent on someone for care. The nurse will guide you through the basic principles of managing at home while you are recovering from your surgery to ensure that the surgery does not prevent your participation in everyday activities. Do you have any questions at this stage?
Shall I know about the checkups after discharge, and also, if I have any more queries after the discharge, whom I can approach?
Yes, sure. You will be getting continuous monitoring both from the general practitioners as well as from the community health nurse. A constant follow-up review is also maintained to ensure that you are well adjusted to a new lifestyle and capable of self-care. They will support you during the recovery period so that the surgery does not prevent your participation in social activities. Home visits will be arranged to monitor your health and support in case you experience any difficulties.
Oh really? That's great.
Would it be okay if I schedule a meeting with the stomach care nurse tomorrow? It will give you the opportunity to discuss your fears about having surgery and post-surgery with her.
All right, that's quite okay with me. Anyways, thank you so much for your time. You cleared my worries to a greater extent. Now I have an idea about my life after the surgery.
Thank you, it's my pleasure. I hope I have cleared your concerns. Kindly feel free to ask if any. I will be there in the next room. If you need any help, please ring the bell which is placed on the right-hand side of your bed.
Oh. Sure. Thank you.
Thank you. Get well soon. Take care.
So, this is the end of your OET speaking session. Thank you.
Thank you, sir. Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.